Hi, I'm Rutuja Patil, a biotechnologist turned public health researcher. I am a senior scientist at the KM Hospital Research Center, Pune. My work revolves around longitudinal studies and implementation research in rural and tribal communities of Pune district. I'm also the governance lead of the Indian HDSS network. So, what is HDSS? The Health and Demographic Surveillance System is a longitudinal cohort based system that tracks the health and demographic changes of a geographically defined population. It serves as a platform for research and evidence based policy making. My institution, KMHRC, has been implementing Vadu HDSS since 2002. This is also the second HDSS in the country. However, over the last 2 decades, nearly 20 HDSS are initiated or are planned by various both public and private institutions across India. HDSS sites in India are looking forward to providing policy relevant output and envisage complementing the government's effort to enhance public health research in India and globally. In 2022, I brought all these 20 sites together and formed the Indian HDSS network, which is now named as IHN. A network of HDSS sites holds prospect of using regional data to bridge gaps in evidence and help policies in national context. Also to develop a local understanding of the health issues. Multi-site collaboration among HDSS sites across India can provide comprehensive evidence of demographic and health issues and challenges and gaps for the Indian population. The IHN is currently in its nascent stage and needs to be driven by motivation considering fairness, inclusion and integrity. So forming and maintaining a cohesive network of HDSS sites is complex. It involves diverse stakeholders with various and varying priorities and capacities, and hence an effective governance and collaboration mechanism is needed. This will ensure smooth functioning and alignment with the public health goals. As I was nominated as the governance lead for the network, my project aimed to formalize the network governance and create operational guidelines, establish communication channels, engage with external stakeholders for insights and funding support. So as the first step, I organized a meeting of all sites in September 2022, which was attended by 35 participants from 16 HDSS sites. Representatives from global agencies like BMGF and WHO also attended the meeting. It was a successful meeting. Further, I established a communication channel in form of a Google group which includes 42 participants from 20 member sites, and it is an active communication channel right now. I have also created information material which is now part of the IHN's introductory docket along with the profile paper of the network. The third outcome which I planned during my project is yet to be achieved, but I have taken efforts to secure resources by drafting proposals and submitting it to the BMGF. However, I managed to kickstart the first collaborative activity where I brought 5 HDSS sites together for collecting additional data on understanding women's migration during pregnancy. This project required minimal resources, and we also presented an abstract at an international conferences with these data. Lastly, the major work went in creating a guidance document for the network which will act as a bylaw. This document includes vision, mission, governance structure, membership criteria, financial aspects and policies. This document is currently being reviewed by the network members and soon will be formalized. The WomenLift health journey helped me in making my project more impactful, as I could provide space and platform for all the network members, making them take owners of certain activities of the network. I'm working on creating the collaborative governance model which will help in creating a transparent system for the network. And I could definitely see an impact of my project which will translate into better health solution in the long term for the community and for our nation. In coming months, I plan to formalize and strengthen partnership for a sustainable network and funding. I'll foster and have updated collaboration model within the network and expand the network's influence in shaping national and global health policies. Thank you.